Welcome to Caldwell County Today. I'm Paige Counts, Public Information Officer for Caldwell County. Joining me today is Jason Powell, Community Paramedic with EMS. Welcome, Jason.
Thank you, Paige.
So, Jason, tell us where we are today.
Well, today we are positioned in our monoclonal antibody infusion site. This was set up a few weeks ago. We had it completed last week so that we could start this collaborative approach to treating patients here within Caldwell County using the antibody infusions.
And as a community paramedic, you are one of the people delivering the infusions. Tell us what that experience has been like.
Yes, so the experience it's been good so far. We're getting referrals that are coming through the health department, through emergency services. There's certain criteria that folks are going to need to be able to meet to be able to get the infusions. But as far as the process goes, it's been seamless. The folks come in, we greet them, do our demographic information, obtain that so that we can start our documentation. As you can see, we've got four separate areas that we're able to administer at one time if need be. There's only two of us right now administering it, Tara and myself. But hopefully once we're up and rolling and folks start to hear about more out in the county and surrounding areas, we'll be able to infuse folks and get them feeling better.
Tell us what the criteria is for a patient to receive the infusion therapy.
Sure. So number one, they have to be COVID positive. The infusion, there are a couple of different ways or criteria that they can meet. One is prophylactically they could get the infusion if they've had a very close contact or exposure. We're not doing that. They must be COVID positive. They must have a referral from their primary care provider as well. We're asking that folks that come through the health department to get tested positive, that they're going to be able to be infused first. Outside of that, we're starting to get our feelers out there. I think Anna Martin could probably answer a few other questions for us regarding that.
Okay, Jason, before I let you go, is there anything you want to add about how you feel about doing this program?
I mean, it's exciting. I believe we're one of the only emergency services in the state of North Carolina that's doing that out of 100 counties. So that's awesome to be a part of. It shows how proactive and how aggressive we are with emergency services. Dino DiBernardi, our emergency services director, Anna Martin, our health department director, Jonathan Cook, our EMS division chief. We've all collaborate and come together, and we felt this was an ample opportunity to be able to provide for our citizens here at Caldwell County.
Thank you, Jason. Now I'm with Anna Martin, Public Health Director for Caldwell County. Welcome, Anna.
Welcome, Paige.
Anna, tell us how folks make appointments.
So with appointments, like Jason said, they're by referral only through their doctor. So what they'll do is the doctor will send the referral to emergency services, or they could always call the health department at 426-8400. The front desk will then take their information and give that information to emergency services.
And besides appointment making, what is the health department's role in this?
So primarily what we do is we work with the state and the federal government to receive the medicine. So we'll look at their inventory and see how much is needed within the community, and we'll request that with the state and the federal government and do an inventory system.
Anna, we didn't ask Jason this. Where is this tent located?
So the tent is located beside of the health department. It's on the back side where the sheriff's office is at, right beside the testing tent. Yeah. So with the collaboration with the health department, patients who get tested here at the health department automatically are able to receive the antibodies with the doctor referral. However, we do have a different type of program that they're able to get the antibodies, but Chief Cook can go in a little bit more in detail with that.
Tell us about testing at the health department.
So testing is usually by appointment only, but we do take drive-ups. You just call 426-8400 as well, and that's the same as receiving vaccinations. But they'll get all the information at the front desk, and then they'll come to the side where the infusion center and the testing tent is, and they'll be tested the same day.
Since you mentioned vaccinations, who is eligible for vaccinations now?
Well, right now with Pfizer, it's 5 and up. So we do Pfizer only on Wednesdays. So children 5 to 19 can get their vaccinations, and then anybody else with Pfizer can get that on Wednesdays. So with Moderna, we do those on Tuesdays and Thursdays, and those start at 18 plus. We are also doing boosters for Moderna and Pfizer. Boosters for Moderna are on Tuesdays and Thursdays, and Pfizer's on Wednesdays. There's certain criteria, whether you work with COVID patients directly or you have an underlying health condition, you're automatically able to get the booster.
And how do people get their vaccine?
Just call 426-8400 to make an appointment. They can also show up to get their appointment or to get their booster or vaccine, and they just come to the health department, and most of our vaccines are done on the 3rd floor in one of our large conference rooms in the pod.
What about people who are homebound?
So people who are homebound, we do have a program with our community paramedics, and they work closely with us and able to do their vaccinations and their testing as well.
Anna, is there anything you would like to add?
I don't think so. We're just very fortunate to have this program here at the health department and Caldwell County, and thank emergency services for able to do this for our community.
Thank you, Anna. I'm with EMS Chief Jonathan Cook now. Jonathan, tell us a little bit more about the tent.
The tent, when you arrive here, it's heated and cooled, so it's definitely got a good environment in it. We've got stretchers you can be placed on to receive your infusion for the antibody. It will be an IV infusion, so it will take about approximately an hour and a half to 2 hours total. You'll be in here, so it's a good, comfortable environment. We'll have blankets you can cover up if you get cold, but right now it's getting chilly outside, and the tent's pretty well heated at the moment, so it's a good environment.
It is a good environment. I'm not terribly cold in here, so that's a good thing. Talk to me a little bit more. Anna mentioned homebound patients. Talk to me a little bit more about the services for those patients.
Yes, for homebound patients right now, if you do want to get your vaccine and you're unable to get in a car and come up here or go to a doctor's office, if you contact the health department, contact the number that Anna had talked about, speak to them about having our community paramedics potentially come out and give the vaccine to you. You don't have to leave your home. They'll come out there and administer it, and you'll be able to, they'll sit and watch you, make sure you don't have an allergic reaction or any type of reaction to it, and it's as simple as that.
Tell me about 911 callback.
So about a month ago, we were approved through the Office of EMS with North Carolina. We put a protocol in place due to the hospitals being so overwhelmed with COVID patients. We were taking patients that didn't have medical emergencies. They might have just had fevers and wanted to go be seen at the hospital. We've got a refusal form in place now where if you don't meet a certain amount of criteria, we can leave you with a COVID kit at your home, and the COVID kit contains a pulse oximeter, so it measures your oxygen in your blood. We'll leave you with a thermometer, some alcohol prep pads, and some literature which explains when you need to call 911 back or when you need to seek further emergency care. If our crews come out to your house, if you call 911, they give you this kit. If you want to go to the hospital, of course, we're going to take you. But if you don't meet that criteria and you might just be a little anxious and need somebody to talk to, make sure your vital signs are good, they'll give you this kit, and our community paramedics will contact you back within 24 hours to make sure you're doing well. If you're not doing well, they'll come out and visit you, they'll recheck your vitals to make sure you're still stable. If you're not, we'll make sure you get to the proper place for further help. This is also going to be key in the monoclonal antibody infusions as well, that if we see that you meet that criteria, then you can possibly be able to, as long as your doctor signs off on it, signs a form, that you can come up here and receive the infusion as well.
So really looking out for the entire community.
Yes, ma'am. We sure are.
Anything else you would like to add about infusion therapy, the services you're providing, community paramedics?
Honestly, and I'm not sure if Jason talked about this or not, but what an antibody is, people are really confused with it. It's a protein that is made that is we infuse in you, and it kind of searches around through your body, and it's familiar to some sort of invader, which this one of course would be COVID. So it will attack that virus and try to deactivate it. Essentially, it works with some people it doesn't. Some people get the infusion, they immediately start feeling better. Others, it might take several days to feel better. It's had a lot of great, it's shown to keep people out of the hospital, which is the number one priority and why we wanted it to be utilized here.
Thank you, Chief, and thank you for joining us.